Thank you, colleagues. Now, our next item of business is a statement by the First Minister, Nicola Sturgeon, on COVID-19. The First Minister will take questions at the end of her statement. I would encourage all members who wish to ask a question to press their request to speak buttons. And I call on the First Minister.
Presiding Officer, I will update the Chamber today on the current position in relation to COVID. I'll give an assessment of the current course of the pandemic, propose difficult but important temporary measures to stem the increase in cases, set out how we will support businesses affected by them, and update the Chamber on the longer-term work we are doing to further improve our ability to live with COVID. In all of this, I will be very frank about the challenges we face and the difficult balances we must try to strike. None of this is easy. I am acutely aware that in every decision we take, lives and jobs are at stake, and I want to assure not just the Chamber but the country that none of these decisions are taken lightly. First, though, let me give a summary of the daily statistics that were published a short time ago. Since yesterday, an additional 1,054 cases have been confirmed. That represents 13% of people newly tested and takes the total number of cases to 34,760. A total of 319 patients are currently in hospital with confirmed COVID. That is an increase of 57 since yesterday. And 28 people are in intensive care, which is an increase of 3 since yesterday. I regret to also report that one further death has been registered of a patient who had been confirmed as having the virus, and the total number of deaths in Scotland under that measurement is now 2,533. National Records of Scotland, though, has also published its weekly update today that includes cases where COVID is a suspected or contributory cause of death. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID was 4,276. 20 of those deaths were registered last week. That is the highest weekly number of deaths since late June. Every single one of these deaths represents the loss of an irreplaceable individual, and again, I want to send my condolences to all those who are currently grieving. These figures illustrate the rising challenge we again face from this virus. That challenge is also set out starkly in an evidence paper published today by the Scottish Government's senior clinical advisors, the Chief Medical Officer, the Chief Nursing Officer and the National Clinical Director. It assesses our current situation in relation to COVID, and it explains, as I will try to do in this statement, why we must introduce additional measures to control the virus, why it is urgent that we act now, and why we have decided upon the specific actions that I am setting out today. Before I come on to that, though, let me emphasise some of the more positive elements of our current position, because it is important, I think, for the morale of all of us, that we don't forget that progress has been made. It might not feel this way, but the situation now is better than it was in March. We're benefiting from the sacrifices made over the summer by driving the virus to very low levels. Then we have helped to ensure that even after several weeks of increases, the estimated total number of cases is currently just 13% of the peak level back in March. Cases are rising, but not as quickly as they were then. In addition, and most importantly of all, we now have Test and Protect teams across the country who are doing exceptional work. Test and Protect is now bearing a lot of the strain of controlling the virus. And of course, we understand more now about how to reduce the risk of transmission by meeting outdoors rather than indoors if possible, wearing face coverings, cleaning our hands thoroughly and keeping our distance from people in other households. So while there are significant restrictions still in place and they are hard and painful, we are living much more freely now than in the spring and early summer. And we are determined, if at all possible, that this will continue. So I want to be clear, we are not going back into lockdown today. We are not closing schools, colleges or universities. We are not halting the remobilisation of the NHS for non-COVID care, and we are not asking people to stay at home. So while the measures I announced today will feel like a backward step, and in many respects I know they are in the interest of protecting our progress overall. It is by taking tough but necessary action now that we hope to avoid even tougher action in future. Let me turn now in more detail to the state of the virus. The need for action is highlighted by the daily figures I reported a moment ago, but more fundamentally in the evidence paper published today. It's worth remembering that when I updated Parliament just over 2 weeks ago, the average number of new cases being reported each day was 285. That was up from 102 3 weeks previously. Now we are reporting an average of 788 new cases each day. In addition, I can report that in the 7 days up to Monday, the number of people in hospital with COVID increased by almost 80%. And the number of people who died with COVID last week was the highest for 14 weeks. In fact, there was the same number of deaths in the last week alone as in the whole of the previous month. The increase in the numbers of people in hospital with and sadly dying from COVID reflect the rise we are now seeing in new cases amongst older age groups. In the second half of September, cases were rising most rapidly in the younger age groups, but in the past week, cases in people over 80 years old increased by 60%, and cases in the 60 to 79-year-old age group more than doubled. And we're seeing geographic as well as demographic spread. Without a doubt, and by some distance, the highest levels of infection are across the Central Belt. We are particularly concerned about Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley, and that will be reflected in what I say later. But that should not obscure the fact that numbers are rising across the country. The majority of our health board areas are now recording more than 50 new cases per 100,000 of their population each week, and virtually every health board area has a rising number of cases. The only exceptions are Orkney and Shetland, and even they have had cases in recent weeks. There is also, as we speak, a significant outbreak in the Western Isles. So the need to act, and to act across the country, is clear. What is also clear is the need to take additional action now. I mentioned earlier that prevalence of the virus is currently around 13% of its March peak. However, we estimate that the number of new COVID cases is currently growing by around 7% each day. So without action, and this is perhaps the starkest warning in today's evidence paper, we are likely to return to the peak level of infections we had in the spring by the end of this month. It's also instructive to consider the experience of other countries. Our modelling suggests that we are approximately 4 weeks behind France and 6 weeks behind Spain in the resurgence of the virus. Their resurgence, like ours, was initially concentrated amongst younger people, but it spread to other age groups, and they are now seeing significantly more hospital admissions, more people in intensive care and more deaths. It is to interrupt that trajectory that we must act now. Of course, we have already taken perhaps the most important and certainly the most painful step we can to reduce transmission. For the last 12 days, apart from certain limited exceptions, we have not been able to meet up in each other's homes. That should already be making a difference to infection rates, even if, because there's always a time lag between introducing new measures and the impact they have, we're not yet seeing it reflected in our figures. And let me take the opportunity to emphasise again today how vitally important it is that we all stick to that rule. It's incredibly hard for all of us not to visit friends and family or have them visit us, but it is the single most effective measure we can take to stop COVID's passing from one household to another. So please stick with it. That measure is vital, but the clinical advice I have received now is that it is not sufficient. We need to do more, and we need to do it now. And to those who will wonder and ask, understandably, if the measures I set out today go too far, let me be very clear about this. If this was a purely one-dimensional decision, if the immediate harm from COVID was all we had to consider, it is very likely that we would go further. But 7 months into this pandemic, I am acutely aware that this is not and cannot be a one-dimensional decision. We have a duty to balance all of the different harms caused by the pandemic. We must consider the direct harm to health from the virus, which must be reduced, but do that alongside the harm being done to jobs and the economy, which in turn, of course, has an impact on people's health and well-being. And we have to consider the wider harms to health and well-being that the virus and the restrictions deployed to control it are having on all of us. For all of these reasons, we are applying a far more targeted approach than we did in March, one which reduces opportunities for the virus to spread while keeping businesses and other activities as open as possible. And we are not recommending that people who shielded over the summer should return to staying completely indoors. We know how damaging that is to your well-being, but we do recommend that you take extra care, especially if you live in the Central Belt. You can now access information about infection levels in your local neighbourhood on the Public Health Scotland website. Let me now set out the additional measures that we are proposing. The measures on hospitality are intended to be in force for 16 days. from this Friday at 6 p.m. to Sunday the 25th of October inclusive. In other words, across the next 2 weeks and 3 weekends. So firstly, with the exception of the 5 health board areas I will talk about shortly, pubs, bars, restaurants and cafes will be able to operate indoors on the following very restricted basis only. During the day from 6 a.m. to 6 p.m. for the service of food and non-alcoholic drinks only. Hotel restaurants will be able to operate beyond 6 p.m. but only for residents and without alcohol. The reason we are not closing indoor hospitality completely is that we know the benefits in terms of reducing loneliness and isolation, of giving people, particularly those who live alone, somewhere they can meet a friend for a coffee and a chat. But the restrictions will be strictly applied, and all the current regulations and the limits on meeting a maximum of 6 people from 2 households in indoor public places will still apply. Again, with the exception of the Central Belt areas I will mention shortly, bars, pubs, restaurants and cafes can continue to serve alcohol outdoors up to the existing curfew time of 10 p.m. and subject to the 6-2 rule on group size. There will be an exemption to these rules in all parts of Scotland, Presiding Officer. It's important to stress this, for celebrations associated with specific life events, such as weddings that are already booked and funerals. The current rules for those will continue to apply. These are the new measures that will take effect nationwide. However, because of the significantly higher levels of infection in the Central Belt, we are introducing stricter restrictions in the following 5 health board areas: Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. In these areas, all licensed premises, with the exception of hotels for residents, will be required to close indoors and outdoors. Though takeaways will be permitted. Hotels, as I've said, will remain open for residents. Cafes which don't have an alcohol licence will be able to stay open until 6 p.m. to support social isolation. In addition, snooker and pool halls, indoor bowling alleys, casinos and bingo halls will close in these areas for 2 weeks from the 10th of October. Contact sports for people aged 18 and over will be suspended for the next 2 weeks, with an exception for professional sport. And indoor group exercise activities will not be allowed, although the current rules will remain in place for under 18s. Gyms can remain open for individual exercise. And outdoor live events will not be permitted in these 5 regions for the next 2 weeks. And finally, we're asking people living in these 5 health board areas to avoid public transport unless it is absolutely necessary. For example, for going to school or work, if home working is not an option. We are not imposing mandatory travel restrictions at this stage, and specifically, we are not insisting that people cancel any half-term breaks that they have planned. But in general, we are advising people living in Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley not to travel outside the health board area they live in if they don't need to. And likewise, people in other parts of Scotland should not travel to these areas if they don't need to. More detail of all that I have just set out will be available on the Scottish Government website. I now want to set out some of the reasoning behind these decisions, and particularly the focus on hospitality. I know that the vast majority of pubs, bars and restaurants have worked exceptionally hard over the past few months to ensure the safety of their staff and customers, and I'm deeply grateful to them for that, and I know how tough these, albeit temporary restrictions are for the hospitality sector. But the evidence paper published today sets out why these settings present a particular risk. The R number seems to have risen above 1 approximately 3 weeks after the hospitality sector opened up. And we know that more than 1/5 of people contacted by Test and Protect report having visited a hospitality setting. It doesn't absolutely mean that is where they got the virus, but it does show that these settings pose a particular risk of transmitting the virus. And that makes sense from what we know about how the virus is spread. Indoor environments where different households from different age groups can mix inevitably present a risk of transmission. That risk can be increased in some hospitality premises if good ventilation is difficult and if it is hard to control the movement of people. And of course, the presence of alcohol can affect people's willingness to physically distance. For all of these reasons, significantly restricting licensed premises for 16 days temporarily removes one of the key opportunities the virus has to jump from household to household. Of course, we have already restricted the other of those, which is transmission within our own homes. And this is an essential part of our efforts to get the R number back below 1. It's also worth noting that many other countries are right now introducing restrictions on hospitality, no doubt for the same reasons. Ireland, France, Germany and Belgium have announced a variety of different measures over the past few days. I mentioned earlier that one of the things we are trying to do is balance the public health harm caused by COVID with wider economic and social harms. I know that the measures we are proposing today, although they are temporary, will have a significant impact on many businesses, and I am sorry for that. But since the government is placing an obligation on businesses, we also have an obligation to help them financially. So I can announce today that we are making available immediately an additional £40 million to support businesses that will be affected by these measures over the next 2 weeks. We will work with the affected sectors, obviously, especially hospitality, in the coming days to ensure that this money provides the most help to those who most need it and that it gets to them as quickly as possible. For the rest of this month, businesses can also still use the UK Government's job retention scheme, the furlough scheme. However, that now requires a significant contribution from employers. So one of the things we will discuss with businesses in relation to our own support package is how we can mitigate some or all of that contribution. As I have indicated, our intention is that these additional measures will be in place for just over 2 weeks, incorporating 3 weekends from 6 p.m. on Friday for hospitality to Sunday, the 25th of October. Of course, we will keep the situation under review between now and then and keep Parliament updated. But we hope that the restrictions already in place and those I have announced today will stem the increase in new cases. But I can't stress enough that that fundamentally is down to all of us. The more we comply with all of the restrictions and all of the advice, the more effective they will be. It's also important, because we do want these measures to be temporary, that we use the next 2 weeks to prepare, protect and prevent, to further strengthen our resilience and our ability to live alongside this virus. So I can confirm that we will also, over the next period, take the following steps. Firstly, we will introduce regulations to extend further the mandatory use of face coverings in indoor communal settings. This will include, for example, staff canteens and corridors in workplaces. We will take action to strengthen compliance with the different strands of the facts advice, focusing particularly on areas where we know from our own research that compliance is not yet high enough, for example, the need to self-isolate. I can also confirm that from this weekend and across Scotland, we are asking shops to return to 2-metre physical distancing and asking them to reintroduce the mitigations they put in place earlier in the pandemic, for example, one-way systems in supermarkets. We will also work across all other sectors to review and, where necessary, tighten the guidance and regulation on their operating practices. And in addition, over the next 2 weeks, we will be conducting a further review of our testing strategy, setting out the further steps we will take to expand capacity, which is already well underway, and build resilience, and also the further steps we will take to extend testing to more people and more groups of people in our society without symptoms. And lastly, we will finalise a strategic framework setting out the different levels of intervention which can be adopted in future, either locally or across Scotland, depending on how the virus is spreading. We very much hope to align this broad framework with those being considered by other UK nations, although of course each nation will take its own decisions on implementation. We will, subject of course to Parliament's agreement, put this strategic framework to a debate and vote in Parliament in the week after the October recess. Presiding Officer, I am well aware that the measures I have outlined today are disruptive to many businesses, obviously, especially hospitality businesses, and they will be unwelcome to many people across the country. But although they are significant, as they need to be to make an impact, they do not represent a lockdown. In fact, they are designed to reduce the likelihood of a future lockdown. We're not requiring people to stay inside all day as we were earlier in the year. Schools will stay open, learning will continue in our universities and colleges, shops will continue to trade, businesses like manufacturing and construction will continue. And these new restrictions are intended to last for 16 days. They are intended to be short, sharp action to arrest a worrying increase in infection. Although they are temporary, though, they are needed. Without them, there is a very real risk, Presiding Officer, that the virus will run out of control by the end of this month. But with them, we hope to slow down its spread, and that will help us keep schools and businesses, including hospitality businesses, open over the winter. And fundamentally, it will also save lives. So I'm asking everybody across the country to please follow these new rules and continue to take the other basic steps, difficult but basic steps, that we know will protect you and each other. Please do not visit each other's homes for now. Work from home if you can. Download the Protect Scotland app if you can and haven't already done so. And of course, remember facts. Face coverings, avoid crowded places, clean hands and hard surfaces, 2-metre distancing, and self-isolate and get tested if you have symptoms. Sticking to all of this isn't easy, and after 7 long months, it is harder than it has ever been. But it is essential. It is the best way to look out for each other, and now more than ever, we all need that spirit of love and solidarity that has served us so well. And hard though it is to believe it right now, all the hard sacrifices we are making will hasten the brighter days that do lie ahead. The pandemic will pass, so let's do all we can to help each other through it. Let's stick with it, and above all, let's stick together. And my thanks again to everybody across the country for everything you are doing.
Thank you very much, First Minister. The First Minister will now take questions. Ruth Davidson.
Thank you, and I thank the First Minister for advance notice of her statement. When the First Minister stood here 15 days ago to reintroduce national restrictions for the first time since lockdown had started to be lifted, I said that the Scottish public were steeling themselves for a long, hard winter. In the last fortnight, they've not been allowed to visit friends or family in their own home. The number of households they can meet in public spaces, both indoor and out, has been curtailed. Businesses that were looking to reopen have remained closed, and those who had been allowed to trade again have seen their hours cut. That's been a bitter pill to swallow for many, but they've done it. And they've done it because they were told that if they did, it would stop the rise of infections that we'd started to see. And people are now being asked to give up even more. They can see that cases are rising, and they are willing to act, to stick by the rules and to do their bit. But we need to acknowledge that the First Minister's announcement today is putting further massive restrictions on people's lives and livelihoods. In the weeks ahead, the whole country will be in the firing line, but perhaps no more so than Scotland's hospitality sector. Like other small businesses, they are looking to the First Minister for a clear statement of what support they can expect. Yesterday, the Scottish Federation of Small Business said that the bare minimum that those in business expect is for the Scottish Government to set out their new package of help at the same time as they detail any new restrictions. Well, we've had the headline figure today, but we don't have what small businesses really need, the details, and they can't afford to wait. Many are running on empty, all reserves are gone. So what they want to know today is, how much can their business apply for, how do they apply, and how long will it take for any money to reach them?
First Minister.
These are all perfectly legitimate points and questions. Can I say, I know how tough this is for people, and you know, I am aware of that in every single decision I take. I'm very aware of the fact that these are horrendously difficult decisions to take, but that is as nothing compared to how difficult it is to live with the consequences of them. And there is not a moment of any day that that is not very much in my mind. On hospitality, the other thing I would say before I come on to hospitality and businesses is we see a rising tide of infections across the UK, across Europe, across the world. This is still an accelerating global pandemic. This is very difficult, and it feels incredibly difficult for people right now. And it is important not to underplay that, but it is equally important not to underplay the progress that we have made that allows us to have much more freedom now than we did in lockdown earlier in the year. And it's important that we stick with these restrictions in order to preserve that. It's also important for me to pay tribute to and thank, on behalf, I'm sure, of people across the country, the Test and Protect teams who are doing so much work across every part of Scotland to try to bear as much as possible of the strain of controlling the virus. And that is a significant step forward from the position earlier in the year. I'd make 2 points about hospitality, and they refer to small businesses in particular, but it's particularly hospitality businesses that are affected by what I have announced today. Firstly, I am conscious, and this is not intended as a criticism of decisions that any other governments are taking, but because we have done it to some extent as well with the 10 p.m. curfew. There has been a tendency in recent weeks to keep hospitality businesses open, but restrict more and more what they can do. So effectively get them into a position where they may feel as if they are all but closed and not give financial support to help them. We've decided today to take, I think, a more honest position and to put further restrictions on hospitality, but to offer significant additional financial help. And I think that is a more honest and more straightforward way of treating the sector at this time. The question about the package is also an important one. I've made clear today there is significant additional funding that will be made available. I looked yesterday at different options for how this money could be allocated. And what I decided to do is take a day or so after this announcement to allow consultation with the sector, so that we can hear from them how they think this money should be best allocated, the priorities for it and what package would best meet their needs. That's not a process I want to take a long time, but I think it is important, given the impact on the sector, to allow them to have that input. And we then want, as we did earlier on with Aberdeen, for that money to flow quickly to affected businesses. But it is important to recognise that where there have been restrictions on hospitality over recent weeks, in all parts of the UK, it hasn't come with additional financial support. We're changing that today and making sure that the burden that these businesses will bear in the next 2 weeks is reflected in the support that we're providing.
Thank you. Richard Leonard.
Thank you. And can I thank the First Minister for advance sight of her statement? The Scottish hospitality sector is not Sodom and Gomorrah and should not be treated as such. Why doesn't the First Minister consider closing down those businesses which are not complying with guidance, instead of shutting down every single business serving 70% of the population, including those which are fully complying? Where is the evidence that COVID is spreading in all hospitality settings to warrant a blanket ban on all of these establishments? Can the First Minister explain the terms of the review after the initial 16 days? And can the First Minister outline how the £40 million mitigation the government is proposing for those hospitality businesses forced to shut down will be distributed? If she's going to have a consultation, will she speak to the trade unions, and will she take into account that every single worker, as well as every single business, should be covered for all of their losses, including those young workers, many of whom are on minimum hours or 0 hours contracts?
First Minister.
I'll touch on the financial part of Richard Leonard's questions. I think my answer to Ruth Davison answers the question. This is taking a day or two to talk to the sector to make sure that as we allocate that money, we're doing it in the way they think is going to best help the businesses affected, and I think that is an important thing to do. Let me stress that we are digging deep to provide this support because we think it is the right and necessary thing to do given the restrictions that are inevitably being announced today. But we are also seeking to work with the UK Government for additional support to be made available across the 4 nations, and the other devolved administrations are pressing this point again for any steps that we have to take in future, because our budget is finite and it is not possible for us to continue to take these compensatory steps beyond where we are right now. Of course, we'll talk to the trade unions. We will talk to the trade unions in everything we do, but of course we want to make sure this money gets to businesses as quickly and as effectively as possible. On the point of evidence, I don't know if Richard Leonard has had an opportunity, possibly not, because I think it was just published shortly before the statement today. The evidence paper that has been prepared and published from the Chief Medical Officer, the Chief Nursing Officer and the National Clinical Director looks at the evidence that we are putting forward for the focus of these restrictions. This is not hospitality's fault. Nobody is pointing the finger of blame. It is not. 2 things I think it's important to point out. One is we cannot, in any case of the virus, it takes genomic sequencing to do this, but Test and Protect, when they interview people to see where they've been when they test positive, that does not necessarily mean that if they say they've been in a pub or a restaurant, they got it there. But it does show that it is an exposure and also somewhere that they could have got it or that they could have transmitted it when they were positive. And because of some of the characteristics of hospitality, sometimes poor ventilation, places where people, particularly with alcohol, are mixing more and not maintaining physical distancing, even where premises are making a significant effort to comply with all of the regulations, as the vast majority are, these are higher risk settings in terms of the virus transmitting. If we want to make a big impact on arresting this rise in cases, there are two things that my advisors say we have to do. Limit interaction between households in domestic settings. That's what we've done. And limit interaction between different households and between people generally in other settings where they are more likely to come together, and that obviously includes hospitality. None of this is easy, none of this is straightforward. There are no straightforward, easy solutions to any of this, but we must arrest this increase in order to have and retain as much normality for individuals and businesses as we go forward deeper into the winter. And lastly, on the review, it is our firm intention these measures will be lifted at the end of 2 weeks. That is not, I'm not saying I'll first come back to Parliament and say that. They will be lifted at the end of the 2-week period, but obviously it stands to reason that we will monitor the virus between now and then, and if there are any changes to any of that, we will report to Parliament. But our intention is these are time-limited measures.
Thank you. Patrick Harvey.
Thank you, Presiding Officer. Absolutely everybody will recognise that these new restrictions are regrettable, but in the face of the rising number of infections, I believe they are necessary. The situation, though, does reinforce the need for continued support for people's incomes, for workers' incomes, not just business owners. The job support scheme is clearly not a sufficiently flexible replacement for furlough, given the need for local and national measures to meet Scotland's particular circumstances. So I would endorse the call on the First Minister to ensure that the £40 million that she's just announced is not only available for business owners, but does support the incomes of the employees in hospitality businesses whose incomes will be affected. I want to note as well the success that people around the world have seen from the country of New Zealand by showing strong leadership which I think we should follow. They have achieved for the second time elimination of community circulation of this virus. They're now able to lift restrictions because they were imposed quickly and clearly enough to drive down infections. This is a lesson that we and other countries should take seriously. I welcome also the review of testing the First Minister has announced. This, as the First Minister knows, has been an issue that Greens have persistently raised with the Scottish Government, and we're all aware of the shortcomings of the UK testing systems. So can the First Minister tell us more about the work being done to build capacity in NHS Scotland to conduct that testing? And does she agree that the review that she's just announced must look at a wider role for regular routine testing for groups within the population?
First Minister.
Can I thank Patrick Harvey? Let me address each of these points. Firstly, on support for workers as opposed to just support for businesses. I absolutely agree. I specifically said in my statement that one of the things we want to talk to businesses about ensuring that our financial package can help with is the contribution that businesses now have to make to the job retention scheme, which is greater than it was in weeks gone by. Businesses can, for the rest of this month, still make use of that scheme and re-furlough workers, but they have to be a bigger contribution. So we hope that this will help make a contribution to that, and that will, by extension, help workers of these businesses. It is absolutely imperative, though, that we see further action from the UK Government on support for wages for businesses who will continue to be affected by the effects of COVID, but also further financial support for not just Scotland, but for Wales, Northern Ireland and England and parts of England when restrictions have to be imposed. And I would say this week there have been some positive discussions on a four nations basis about that, and I would hope we will see progress in the not too distant future. On the point about New Zealand, I, on one level, very much agree. I think there's a lot to admire about New Zealand generally and about their current leadership. I probably shouldn't go too much further on that since they're currently having an election at the moment. But New Zealand has not been without its trade-offs. Every country is making trade-offs, and right now, yes, New Zealand has a different approach domestically, but its borders are completely closed. You cannot come in and out of New Zealand without, at the very least, very, very strict quarantine. We are not geographically New Zealand, obviously, and there are different issues at play in terms of Scotland's integration, not just with other parts of the UK, but with Europe more generally. So no two countries are identical. We look to learn from all countries where we can, but we have to adapt to our own circumstances, and that's what we are seeking to do. And lastly, on testing, we are on NHS capacity. We are in the process of creating a number of regional hubs that will significantly increase NHS capacity. We are also already transferring care home testing over to the NHS in order to give us more capacity through the UK system. But the increased NHS capacity will give us more scope to expand where clinically advised, and I will keep stressing that point, regular routine testing of asymptomatic groups in the population. We are already looking at further groups within the NHS, but within the wider population, we will look at that as well. But it's important that that is clinically advised, because my clinical advisors would say that does not always make sense to do in every part of the population. But once we've carried out the review I referred to, we will update Parliament further on the next steps that we're going to take.
And Willie Rennie.
I have personally complimented the First Minister on her communications and continue to support the cautious approach. But like so many people across the country, I am now frustrated and disappointed. Why have we had rumours and hints of greater restrictions for weeks, but no upfront evidence or debate? Then this new set of complex measures to be rushed through in a matter of days with little evidence of the likely impact. What has happened to the route map? And what now for the elimination strategy? People made sacrifices for longer here, but the government did not use that extra time well to get ready for this. For instance, why has it taken until now to agree to asymptomatic testing? To many people, this no longer feels like a strategy, but a series of knee-jerk reactions. I want to work with the First Minister to get this right, but we do need a new route map endorsed by this Parliament that everyone can understand. So will she agree to that?
First Minister.
Not only will I agree to it, I announced it in my statement that we will bring a new strategic framework to the Parliament the week after the October recess for debate and vote. All 4 UK nations are working on similar approaches right now, and what we hope to do is align in terms of that strategic framework, although it will then be down to each of us to decide which levels of it are implemented in each nation or in different parts of each nation. So that will come to Parliament in the week after the October recess. I understand that people are frustrated and depressed. I share the frustration and the depression about all of this situation, although I understand it is much harder for many people across the country than it is for me. But we are, as I keep saying, and is a statement of the obvious, in a global pandemic. On the specific points Willie Rennie raised, which are of course legitimate, I constantly have a debate in my own mind about the balance to strike between being open and discursive with people before we reach decisions, to give an insight into the challenges we're grappling with, the factors we're taking into account. That's what we've done over the past couple of weeks. That can then lead to speculation running away from us, and again, that is understandable. The alternative to that is just to keep it all to ourselves and then come today and announce things without any open discussion of the challenges. So we will continue to try to get that balance right. Increasingly, measures are complex, but again, there are difficult balances there. You can be simple and hard, or you can be a bit more targeted, but recognise that the price of that is a bit more complex. We had to do, in our judgment, what we've done for the Central Belt today. The simple thing to do would have been to apply that across the country, but that would have been much too hard for the non-Central Belt parts of the country. So that's where some of the complexity comes from. I've tried to sort of articulate the elimination strategy to Willie Rennie before. I'll have a brief go again. It is always our strategy to eliminate, in terms of getting the virus to the lowest possible level. The challenges of doing that ebb and flow, depending on the range of restrictions you have in place and are prepared to live with. And of course, we now have the winter effect. But it is still our objective. In fact, we are now signed up across the 4 nations of the UK to a strategy that is about suppressing the virus to the lowest possible level. That's why we're putting additional restrictions in place. If we were happy to let the virus just spread with its own free will, we wouldn't be doing that. It's because we want to suppress, and of course, because we suppressed so far over the summer, although we are in a difficult situation right now, we're not in an out of control situation, which we would be already had we not suppressed so far in the summer. And lastly, on asymptomatic, we do test asymptomatic groups. We test workers in care homes every week, whether they're symptomatic or not. We test groups of NHS staff already, whether they're asymptomatic or not. We do surveillance testing as well. What we are going to do now, which we had always intended to do because we regularly review our testing strategy, is driven by clinical advice, look at where we can go next to extend testing into asymptomatic groups of the population. And as I said to Patrick Harvey, we will update on that once we've had the opportunity to do the review.
Thank you. I've got up to 17 members who'd like to ask a question, so I hope we can make progress through them. Annabel Ewing to be followed by Donald Cameron. Annabel Ewing.
Thank you, Presiding Officer. First Minister, the evidence paper published by the Chief Medical Officer today makes a compelling case for action, and today's case numbers show, sadly, that there is indeed a need to act urgently. Is the First Minister therefore content that the package of measures she has announced today go far enough with a view to seeking to bring the virus under control? And I would just mention in this regard, by way of context, that, for example, it was announced this afternoon that in Brussels, all pubs and all cafes are to close completely for 1 month.
Minister.
Annabel Ewing is absolutely right in what she has said about Brussels. The Republic of Ireland earlier this week effectively decided to close hospitality, certainly indoors in all parts of the Republic. I think in Dublin they're also closed outdoors. So we are not out of step. Many countries are having to take these really difficult decisions, and I think it is better to be firm in taking them and to take them early to try to arrest the spread of the virus than to wait longer and find that it is much more difficult to do. In terms of Annabel Ewing's question about am I confident that this will get the virus under control, what we are seeking to do with the very restrictive measures that are in place, both in terms of household interaction and now hospitality, is reduce the risks of transmission in the highest risk settings. And that is very much about arresting the growth in cases and starting to bring them back under control. But I would say this, for that to succeed and for us to bring the virus back under control and keep it there, that will take the ongoing efforts of all of us, not just these particular restrictions, but all of us making sure that we continue to work from home if possible, that we make sure we comply with all of the aspects of test and protect, self-isolation in particular, and we follow all of the other strands of the Facts campaign. And it will be seeking to strengthen compliance. That is one of our other objectives over this next 2-week period.
Donald Cameron to be followed by Kenneth Gibson.
Thank you. The First Minister referred to household transmission as the principal way that this virus is spread, stating that restrictions to reduce this should be making a difference, though that is not yet reflected in the figures. Household restrictions, however, were introduced in Glasgow and 2 other local authorities 6 weeks ago. Given that time frame, is the First Minister able to comment on whether those household restrictions are effective?
First Minister.
What the public health experts who advise the government tell us is, yes, there is evidence, they think, of those measures being effective. There is evidence that what those measures that have been in place longer in these west of Scotland areas have done is blunt the increase in cases. The data is, what they will also say, is complicated, particularly in Greater Glasgow and Clyde, because of the large student outbreak that we've seen in recent weeks. So they do believe that there is that effect there. It is just not easy to see in the overall data because of the different factors that are in play there. I understand, I'll be corrected if this hasn't yet been set up or confirmed, that the Chief Medical Officer and the National Clinical Director will offer some briefing to party leaders or their representatives later on, and I know they would be very happy to go into some of the detail about the data if that is of interest to members.
Kenneth Gibson, followed by Jackie Bailey.
Thank you, Presiding Officer. The First Minister has already mentioned a number of countries that have been looked at in terms of hospitality. I'm just wondering, given the varying rates of COVID-19 and the way it's being distributed, the way it's growing in some countries a lot faster than others, the spread of it, I'm just wondering what else can be learned from other countries and how we can tackle this particular pandemic, and if there are any countries in particular that the First Minister feels we should be looking at.
First Minister.
We look at a range of different countries across Europe and further afield. And I think there are things we can learn from many countries, but all countries are having their serious challenges with this. New Zealand's already been mentioned, I think, and we have tried to learn in terms of that real focus in driving the virus down to the lowest possible level, but the circumstances there in terms of geography in particular are very different to ours. We've looked at some of the actions that have been taken in some European countries over recent times to try to limit the spread. I think, if I'm being frank, again, without criticising any other government in any other country, because my goodness, we're all struggling with this. One of the lessons I would draw just now looking at France and Spain is perhaps there wasn't action quickly enough to try to do some of the things that we're talking about here to bring the spread there more under control. Of course, I don't know all of the detail of what these countries are doing. So we try to look for the positive things and also the things to avoid. But it's a global situation. It is still accelerating in most parts of the world. All countries are struggling with it, and I think we all have to continue to learn from each other as best we can.
Jackie Bailey to be followed by David Torrance.
Contact tracing is critical to preventing the spread of COVID-19. 2 cases reported to me this week. One tested positive for COVID-19. 5 days later, he had not been contacted. The other was in direct contact with someone who tested positive in a car for at least an hour. A week later, he had not been contacted to self-isolate. The latest data tells us that a third of people are not being contact traced within 48 hours. And of course, my constituents waited longer. If people don't know, they don't self-isolate, and so the virus spreads. Can I ask the First Minister, in the case of one health board, they recruited contact tracers on the basis of 7 cases a day. On Monday, they dealt with 130 positive cases. So isn't it the case that not enough contact tracers have been recruited to cope with the existing demand? So how many more contact tracers will be in place by the end of the month when restrictions are lifted?
First Minister.
No, it's not the case. We have resources in place across health boards. We also have the National Contact Tracing Centre that assists health boards, and we will continue to expand that resource as and when we need it. I've already set out many times what we did in terms of creating the pool within health boards and then replacing that with permanent recruits along the way, but that pool is there in health boards. And can I say to Jackie Bailey, if any member, or actually say to all members, if any member has been contacted by constituents who say that they believe they should have been contacted by Test and Protect and haven't been, don't wait to tell us that. Get in touch so that we can follow that up straight away. Well, good, I'll make sure it's followed up. We have got expert Test and Protect teams across the country. And actually, what we are finding is that, and people can go because it's publicly available information and compare it, contrast it across different parts of the UK. Our Test and Protect teams, from a minute a positive case goes into the case management system, we are seeing more than 90% of index cases and contacts successfully traced and followed up. And that is very positive. Of course, there will be difficulties in some cases, and sometimes there will be errors made. That no system is absolutely infallible, but Test and Protect is working really well, and I think it deserves our credit and gratitude. There are issues in terms of which actually have improved, and we continue to work with the UK Government to make sure that the time from somebody being tested to the result going into the case management system is as short as possible, and that the turnaround times continue to improve. But Test and Protect is doing a great job, and I really do think they deserve our support and our thanks.
David Torrance to be followed by Jamie Green.
Thank you, Presiding Officer. Self-isolation can be incredibly tough, but it is essential to reduce the spread of coronavirus and ultimately save lives. However, people should not have to make a choice between self-isolating and supporting themselves financially. So can I ask the First Minister what support the Scottish Government is providing at this challenging time to ensure people don't fall into financial hardship? And will the Scottish Government continue to press the UK Government for clarity around the consequential funding for a support scheme that was recently announced?
First Minister.
The support scheme is the key way in which we will help those on low incomes to self-isolate if they're asked to do so. That's a payment of £500 that will be administered through the Scottish Welfare Fund and targeted particularly at people on universal credit, although there'll be some flexibility to reach others who are in need. We are also working with local authorities to make sure that when anybody is given advice to self-isolate, there is a proactive contact made with them in order that even if they don't need financial help, if they need help with having food or medicines delivered, then that can be provided. It is essential that if we are asking people to do the very difficult thing of isolating for 14 days, then they have the help that is needed. And yes, we do continue to pursue with the UK Government the consequential funding for the support scheme. We are in discussions as I said earlier on, about additional support that we think will be necessary, but also the reconciliation of the consequential funding that has been made available so far for the pandemic, which has is being fully utilised in Scotland, and therefore any new scheme such as the support scheme requires additional support through the consequential stream.